Robin Hood Unplugged. We are super excited to have our Leadership Council member, Stephanie Ruhle, and three leaders from our community partners at Robin Hood here to talk about this really pressing topic. With that, I'm going to hand it over to Stephanie. And again, thank you all for joining us.
Thank you so much for including me in this conversation. I'm Stephanie Ruhle with NBC News and a proud Leadership Council member with Robin Hood. Tonight, as part of our Robin Hood Plugged In series, if you knew us before the pandemic, this is a virtual transformation of Robin Hood Unplugged, where we invite Robin Hood partners to come engage and learn about issues that are pressing and growing in our city and across the country. And tonight we bring together three partners and community leaders that are fighting every day to help some of New York's most vulnerable people, specifically women. And that's what we're going to talk about tonight on the heels of Mother's Day. We all know, we hear it every day on the news, in our community. COVID has disproportionately hurt women, specifically women in vulnerable communities, whether it was women who had jobs at risk, who lost jobs first, women who were forced to go home and care for their children, or if you think about all of the women that face pregnancy, childbirth, and newborn care amid a global pandemic, it has been a devastating year. And even now, as we re-emerge through this crisis and get back to work, you can see by last week's jobs report, men are making it back to the workforce, but women, we know 3 times as many women left to care for children during the pandemic are still not back at work. Why? Well, in large part, childcare, the vicious cycle. Without affordable childcare, we cannot get jobs. And if we do not have a good job, we can't afford childcare. We know the administration is talking about taking this on, but I want to bring in 3 women who take it on every single day and introduce our community partners. Bertina Ceccarelli, she's the CEO of NPower. LaRay Brown, CEO of One Brooklyn Health System, and Myra Jones-Taylor, Chief Policy Officer from 0 to 3. Ladies, thank you so much. I want to get into a lot, but I first want to start, I would love it if we could just go down, Bertina, to you first. Introduce your organization to this group because some of us aren't familiar.
Stephanie, thank you so much. It's great to be with you, Myra and LaRay. NPower is a national nonprofit. We are headquartered right here in downtown Brooklyn. And our mission is to move people from poverty to prosperity through tech skills training and great jobs that have a career track.
LaRay?
Hi, it's great to see everyone on the screen. And Stephanie, good to see you again. One Brooklyn Health System is comprised of 3 safety net hospitals that have a long tradition of serving the residents of Central Brooklyn. We are responsible for more than 1 million people in the neighborhoods that our hospitals, nursing homes, and community health centers fund. I say that we're a safety net hospital system because the preponderance of our patient population is insured through government programs, most notably Medicaid and Medicare. We offer a full range of healthcare services, including the provision of maternal and child health services.
Myra?
Thank you. It's so great to be on this panel with my esteemed panelists. So at 0 to 3, we've been around for over 40 years, and our sole mission is to make sure that all babies have a strong start in life. We do that by supporting parents, professionals, and policymakers to make sure they have all the information and really the passion to make sure that all children have a strong start in life. It's great to be with you.
All right, then let's get into it, because as we think about how we can support women in this hopefully post-pandemic world, there's sort of 3 main categories that come to mind: maternal health, childcare, and jobs. And obviously all 3 are interconnected. LaRay, I want to start with you because we often hear about different health outcomes, and we hear about health equity as it relates to access to the vaccine. But I want you to help us understand it in terms of maternal health, right? You have people in your community who face higher mortality, infant mortality, and maternal mortality rates than other communities. Can you help us understand these health disparities, why they exist, and what can be done about it?
Well, the neighborhoods that we serve have many indicators of poor maternal and child health, including poverty rates. For example, in New York City overall, the poverty rate is 20%, but there are neighborhoods in central Brooklyn where the poverty rate is 28 and 30%. And clearly, the economic health affects physical health and very specifically affects maternal and child health. We have a significant number of moms, expected moms, who get late or no prenatal care. One of the big issues that we're working on in terms of our maternal health strategy, but 6.7% of women who live in New York City overall get late or no prenatal care. But again, in communities in central Brooklyn, it's more than 15%. Infant mortality, as you mentioned, Stephanie, is higher in our neighborhoods. And we also have higher teen birth rates and higher childhood obesity rates, which affect the long-term health of young women and women who become pregnant. So these are some of the negative things. And they're in a context of the social determinants of health. I should add, however, that the people who live in central Brooklyn neighborhoods are also affected by the stressors of unsafe and unaffordable housing. You mentioned the impact of the loss of employment and the stressors related to that. My colleague talked about her organization really focusing on individuals being able to step up on that career and that income ladder, incredibly important. But the other thing that we're dealing with is the fact that even if you put aside education, income, African-American women are 3 times more likely to die in childbirth than white women. And so we have these other indicators, but we also have an issue with regards to bias, racial bias in the provision of maternal health, in healthcare in general, but the life and death consequences of institutional and racial bias in the provision of health services to pregnant women and women from a postpartum perspective.
LaRay, that is a lot. You are also a Robin Hood Power leader. Talk to us about your partnership with Robin Hood. And while just listening to you, it feels overwhelming. It's sort of like, where do we even begin? Talk to us about the work you're doing with Robin Hood to start to transform the way we approach maternal health.
Well, I think one of the extraordinary things about the Robin Hood Foundation is its interest in investing in models that work and in spreading those models so that a larger number of people can be positively affected. So One Brooklyn has had the privilege of providing certain evidence-based models that have been proven to improve the outcome of women and infants. We have the Healthy Families model, the Healthy Steps program model, centering pregnancy, baby-friendly and lactation programs. And these are all very important programs. But what has happened is that each of these programs sort of have evolved based on the funding streams, right? And we haven't been able to spread them across the One Brooklyn institutions and health centers so that we can touch the women who live in our catchment area of 1 million people. So the Robin Hood Foundation funding will allow us to take these evidence-based practices and spread them so there's greater benefit to a larger population base, but also to provide us with resources so that we can engage in partnerships with community-based organizations so that they can also work with us in addressing some of those social determinants that I spoke about, and moreover, helping us to develop a partnership with the State University in Brooklyn, SUNY, to provide training to address that unconscious bias that I talked about. All of our hospitals are academic medical centers. We train residents, we train the new doctors. And what we need to do is to build a base of a curriculum where we can begin to ensure that the doctors that we are producing at least know when they are behaving in a manner that is unconsciously biased and therefore restricts the best outcomes for their patients. I would also say lastly is that the Robin Hood Foundation grant will also help us to work with other partners to actually facilitate change, to advocate at the state and national level on policy changes, because the issues around how maternal and child health services are funded, whether insurance entities will pay for certain types of services that are not just the delivery of the baby, but all the services that need to be wrapped around an expected mom and a mom after she has had the baby. These are changes that we want to work with Robin Hood and other partners to facilitate.
Thank you for all that you do. Myra, let's talk about childcare because we hear about it all the time. Vice President Kamala Harris said, this is a call to action. We need to address childcare in this country. Even before the pandemic, the United States was a childcare desert. We did not have on a federal, even a state level, any sort of affordable childcare in this country. Now that we've gone through COVID, it's only gotten worse. There are people of privilege who are watching the news every day saying, oh, well, the Biden administration just allocated $39 billion for childcare. In the American Families Plan, there's $250 billion for childcare. But those are just big numbers. And a big investment doesn't necessarily mean it is a good investment. So can you help us first start to understand when this pandemic hit, what this meant for the lifeline for families, that is for the childcare industry, but also what this did to the childcare industry?
Sure. No, it's a really important question. So 0 to 3, every year we put out something called the State of Babies Yearbook. We just released 2021 a couple of weeks ago. And the State of Babies Yearbook makes it very clear that even before the pandemic, we were not doing right by our babies and by our families. And if you think about childcare in particular, we know that only 1 in 7 babies who are eligible for the childcare subsidy, the childcare development block grant that you spoke about, only 1 in 7 actually receive that subsidy. And that because there has been insufficient funding. So there has not been enough funding for the Child Care Development Block Grant historically for, as long as it's been around. 5 years ago, I spoke to Congress about this. I testified before the Senate Health Committee about this very challenge, even after we had it reauthorized. And 2 weeks ago, I was back on Capitol Hill, well, virtually, testifying again to talk about the need for childcare. So there's a real understanding that even before the pandemic, we were not doing right in terms of childcare. We know, as you mentioned, that in the majority of states in this country, childcare is more expensive than in-state college tuition. We know that families pay, it's one of their top line items when it comes to, the budget line items, when it comes to, comparing that to their rent, their mortgage. Childcare is right up there. Sometimes it exceeds the cost of housing. So this has been untenable for parents. It's also untenable for children. We know that far too many children are in childcare settings that are underfunded, that are under-resourced, that are not of the highest quality that they should be. And we know that early educators are doing incredible work right now. They have stayed open despite many other industries closing because of the, the backbone that they are for this economy and for communities. And it's time that we start acknowledging that and paying them and supporting them to recognize the value that they bring to this country and to communities across the country.
So not necessarily in an ideal nirvana, what can and should childcare look like in this country, but right now there's an actual opportunity. There's an opportunity to start to solve for this and the will to do so. We may have talked about this a year ago, but there was not the will, certainly not from Congress. Realistically, whether it's philanthropic support, or really we may be getting an enormous amount of government support. What could affordable childcare in this country look like?
So we know that, I will say that Congress has been supportive. We've had bipartisan support for childcare for decades, not nearly enough. And so you're right, we're at this opportunity right now to really, actually fund it to the levels that it needs to be funded. What it can and should look like is it should be high quality. We should have educators, caregivers who they are compensated accordingly, appropriately, to make sure that they are not sacrificing for their own families as they take care of our children who are not theirs in centers and programs and family childcare homes. They should be getting the training and support that they need to be able to do the best practice. So they should be getting professional development and support. If they choose to go on to get their bachelor's degree, that should be supported. They should be able to get funding to do that. This is incredibly important, highly skilled work, and we need to accommodate or acknowledge that and account for that in their pay. Parents should be able to find it. It should be accessible and it should be affordable. I already talked about that. And you mentioned childcare deserts. We know that over 50% of all people in this country live in childcare deserts where there's an inadequate supply of childcare for the children in the communities who need it. And then for children, it should be high quality, and that means nurturing environments. That means that they have their inherent curiosity is supported, that there are appropriate ratios. There aren't, the 1-to-4 ratio for a baby, adult to baby, things like that. So we make sure that children are safe and all of their inherent curiosity is really supported in that critical time of child development.
Can you give us, I know at Robin Hood, we've done a lot of work on it, and obviously you have as well. When children have access to quality childcare and that infrastructure day in and day out from 0 to 3 years old, when their parents have that, how does that impact long-term outcomes?
So research is very clear. High quality early learning experiences, high quality childcare sets a foundation for children's future growing, future development, and all areas of development. So physical health, social emotional health, intellectual cognitive health. We know that there is an incredible opportunity there when children have access to high quality support, early learning. For parents, it allows them to get back to work. In the midst of the pandemic, we have seen the number of women who have left the workforce, who've been really shut out of the workforce because of childcare. So when we make sure that childcare is accessible, affordable, and high quality, we're serving really the whole family, and we're serving the economy that has been made so clear in the midst of this pandemic that you cannot have recovery, we cannot have work without childcare. That jobs report made that very clear. The number of men who went back, those were job gains for men and not for women. And that is because of the disproportionate role women play in caregiving and the lack of childcare. It's very clear.
How long will it take to shore up childcare and stabilize things so women can get back, right? Everyone looked at that jobs report and said, like, oh my goodness, what does this mean? Forgetting that even that last $40 billion hasn't made its way into the system yet. We are on an economic recovery, but it's not a fast track. It takes time.
It does take time. So the American Jobs Plan, we were happy to see that there's investments in actually the infrastructure in building childcare programs to deal with those childcare deserts that we mentioned. We are also very excited to see that there's real numbers, there's real support behind shoring up the system that has really been decimated in this last year, but was already crumbling, right? So this does take time, but babies' brains can't wait. Parents can't wait to get back to work. We need to do this in a way that states feel that they have a guarantee from Congress, frankly, that they can get this money out and that it's not a one-time deal, that there will be a American Families Plan or something that will come out of Congress that will really make this a permanent solution.
Bertina, hold on, sorry, working at home studio. Before COVID hit, we saw whether it was policymakers or CEOs thrilled about labor participation for women across this country. We had more women working than we had ever seen before, and people were patting themselves on the back, right, left, and center. Then when the pandemic hit and we saw women basically get wiped out, what was exposed was that women had the lowest wage jobs in the riskiest industries, service jobs, retail jobs, home healthcare jobs. And it was those who had white collar jobs, white guys who could work from home, who ended up thriving the most, who didn't lose their job, who didn't lose any income. So while we saw the vulnerability of women who lost their jobs, we don't just want them to get back to work. We want to get back to work and in better careers. Can you talk about the work that you're doing around training? Because that training will specifically give women and men really the economic empowerment tools to pull themselves from those lowest wage vulnerable jobs.
Yeah, Stephanie, thank you for that. And I do think this pandemic has revealed that as a nation, we need multiple pathways to good jobs that have predictable hours, upward mobility, and a measure of stability. We saw that during this pandemic, that work from home movement, that yes, did benefit primarily white men, but it was fueled by technology and skills in areas like cloud computing, cybersecurity, networking, and IT help desk support are only going to grow. We're going to see that, I think, in the coming months, but especially in the coming years. And that's where NPower comes in. On average, the women of color who enter our program, and largely without a college degree, who graduate from our 6-month program, earn salaries of about $42,000 a year, 3 times more than their pre-program salaries if they were employed. But over 2/3 of the young adults who come to our program are unemployed, and that number was even higher during the pandemic. What I think is most important about the NPower model is that we stay very close to our alumni long after they graduate from the 6-month program. We offer continuing professional development as well as ongoing upskilling, so that a few years after the program, and that could be just as little as 2 to 3 years, they're making $70,000 and up. So building those stackable credentials and that career ladder is absolutely critical. And the approach is really simple. We provide rigorous technology skills training, leading to an industry recognized certification, which is critical if somebody comes to our program, and most do without a college degree, professional development support, mentoring, and access to a paid internship or apprenticeship. Why is that important? Particularly if somebody doesn't have a college degree, a company is looking for experience. So that paid work-based learning is really critical for a young adult, especially a young woman. 81% of our graduates will get a full-time job or choose to continue their education upon completion of the program. Program's free, and our recruitment is primarily focused here in New York on young adults 18 to 25 who have a high school diploma, and about 20% will have maybe a year or 2 of college, but all are experiencing some form of unemployment or underemployment. Over the past 3 years, our specific efforts to recruit young women of color have intensified, especially young mothers. We were fortunate to get a grant from City Foundation and additional support from Robin Hood to be able to make this a key focus of ours. And we've been much more intentional about offering the tools and supports through our social support managers in partnership with great local community-based organizations like Canva, Bronx Works, Bed-Stuy Restoration Corporation, Bottomless Closet, and the New York Psychotherapy and Counseling Center. It's that kind of an integrated, holistic approach that really surrounds our students and nourishes them, that propels them to success. Our women students in particular recognize that they are making a choice to invest in themselves, that they are growing not only their skills and opportunities, but oftentimes their self-confidence. And mothers in the program in particular talk about how they feel they are becoming much better role models for their own children by investing in their futures and that of their families. Finally, one of the things that we've learned in the recent 2 years, we've really focused on recruiting women of color as instructors. So today, a full 50% of our technical instructors and TAs are women of color. And that speaks volumes. It sends such a strong signal to the trainees in our program, men and women both, and also our corporate employer partners, about what the future of tech can look like and should look like.
Bertina, do people do this training from home or do they have to go to your center?
So that's the other thing that we have learned during this pandemic. We are doing everything virtually, and it has really opened up substantial flexibility for particularly young moms, mothers of young children, to be able to take our classes. We've offered a lot more grace and flexibility in hours, more out of class tutoring for those who might have to miss a session because of a childcare issue or just attention that's needed elsewhere. So we've made the decision that once we all get back to some semblance of being in an office, that our program will continue to be more of a hybrid model, and that we will offer that flexibility for remote learning where women in particular need it.
Did your enrollment go up a ton? Because while women were home juggling a lot, they were home and could potentially partake in this. And now that we're returning to the workforce, say, I don't want to go back to that low wage, quote unquote, low skill job. Now I'm trained for something better.
Yeah, Stephanie, last year we had our best recruitment season ever. And it was so encouraging. And, you know, the other thing that gives me great confidence is a lot of our corporate employers also recognize the benefits of remote working. So they were able to fashion internships or other kind of work-based learning, fellowships we called them, to be able to give our students real life work experience, but also hire full time, because again, so much of this work from home activity has been fueled by the need for a lot of tech support, and that's what our students do.
Do we need, or let me rephrase, are we seeing more companies, big and small, start to recategorize jobs to make them skills-based rather than have education requirements? Because it's those educational requirements requiring that 4-year college degree that straight out of the gate knocks out a huge amount of potential employees who could go on to pretty extraordinary careers.
Yeah, Stephanie, I'd like to tell you that that is happening everywhere, but it's not. There are a lot of enlightened companies where, in fact, we do see that to be the case. And they are finding equal results in terms of performance and retention for those individuals who have an industry recognized credential put up against a college graduate. But we still find that there are a number of companies that are really having a hard time letting go of that requirement. And are beginning to make some slow movements to analyze that job position and really assess what's that job content, and is that college degree required technically or for job competencies, or is it really just a proxy for cultural fit, right? And we're really encouraging companies to let go of that and hire the millions of individuals who could qualify for these great tech jobs, who have all the right credentials.
All right, we're going to move on, but then quickly, I want you to make, or I'm thinking, could you give all of us participating tonight a homework assignment? Chances are we work at companies that are big and small employers. And if we do, what can we do? Can we pick up the phone and call our HR department tomorrow and start pushing this at our own organizations?
Yeah, without question. I would encourage everybody on this line tonight to talk to the heads of their IT departments, head of their HR departments, and say, what are we doing to invite new recruits from non-traditional talent, non-traditional channels, where college degrees might not necessarily be the first path or first course of action, but create credentialing programs like NPower or a Year Up or a Perscolis. There's a lot of really terrific programs that companies can benefit from, but most importantly, the individuals in those programs have an opportunity to really transform their earning potential for a lifetime.
Thank you. LaRay, I want to go back to you. Sort of at the height of this pandemic, the reason you and I actually met on television, really sort of in the early months of COVID, when One Brooklyn Health and other hospitals in central Brooklyn were truly being hit the hardest. Can you give us a sense of what is it like in a city like New York when a pandemic hits? What is it like for a hospital like yours versus a hospital that has a lot more private funding from businesses or individuals? What is it like in a time of stress? right? Because we always hear New York hospitals, but your experience is very different from other hospitals in New York. And I think it's important for us to understand that.
Well, and we've talked about this, Stephanie. I think the difference is that we really had to rely on ourselves and the creativity and the compassion and the resilience of our staff, particularly early on when we were competing with the more well-heeled hospitals. So they're being able to hire and onboard more nurses, more respiratory therapists more quickly than we were able to, because they had the cash to do so. But we did bring on additional staff, and we did bring on additional equipment, and particularly PPE for our staffs. But again, we're competing within that larger sphere. One of the things that we did was that, we put in place recognition pay for our staff because we knew that some of our nurses, as an example, could go and work for another hospital system that was paying more money. And it wasn't a lot of money, but just the act of our doing that to literally recognize the support and the loyalty and the commitment of our staff went a very long way. I also think it's extremely important when you have staff, and this goes back to Bertina's point, and as to when you have staff who come from the neighborhood in which you're serving. So many of our staff are from Brooklyn, from our neighborhoods, and they're committed to their neighbors, to their family. And while there were stresses on that staff, because as they were in the hospital saving lives, they were concerned about, well, what was happening to their family members, or were they taking the virus home, which was what was really incumbent upon us as leaders to make sure that they had the kind of protection that they needed, that we afforded them opportunities to, as I've said, to breathe and just to address their stressors. And we've done that over this last year. I think the huge benefit over the last years, we've learned so much as to how to respond, how to treat the illnesses that come with being infected with the virus, and so that has helped to buoy the staff in terms of their work. But also, our staff have been right in there in providing vaccines for our community. And, early on, folks were talking about the hesitancy among certain groups of individuals. Well, we've not found that there has been significant hesitancy amongst our community. What we found is that if you make vaccinations easily accessible, that if you don't require that people go onto a website or get on a phone and have to wait hours to get an appointment. But if you have open access to the vaccinations, people will come in. And so we've provided vaccines to tens of thousands of community members in central Brooklyn, and we're continuing to do that today. And so it's about money always, but it's also about commitment to your community. And that's what has shown through in the last year in hospitals such as ours. Let me just also go back to our maternal and child health programs. One of the huge stressors on our program participants has been the issue of the stress of COVID, the stress of having lost their employment, or a family member who lost employment, the stresses of potential eviction. And so there are many policies that have been put into play to help to reduce those stresses, but they still add to the stress of the women in particular that we serve. The stress of being a teacher and a mom when the children or have not been in school. And as my colleague Myra talked about, the lack of access to dependable childcare, because whether you're working or not, a child should be in a childcare setting to help, again, support their growth. So we've seen a lot of those stresses be experienced by our participants. And some of the biggest challenges that we have is the paucity of mental health services for the parents as well as the children. And so this is something that we have to work on as a society, making sure that mental health services are available, easily available and affordable and accessible to individuals throughout our city, throughout the country. And let me just add another thing, are culturally responsive, because oftentimes we refer a family or an individual in the family for therapy, and they don't participate because they say that therapist can't relate to me. They can't relate to me either because of the language I speak or where I'm coming from from a socioeconomic perspective. So mental health is a big issue for us, and we must work on it. But there are some bright spots, I have to say, and some of my colleagues who are actually work on these projects, what they've said is many of the women who participate in our Healthy Families program have said that they've enjoyed, notwithstanding all of the pressures of being home and not being able to work, they've begun to enjoy that interaction with their youngster. That being forced to be home has really opened up for them the importance of that nurturing relationship between mom and child, or family, or dad and child, etc. And so, we have to also look for those bright spots and figure out how can we help to support those to be sustained even after we get through this pandemic.
Well, for all of us New Yorkers, whether it's on social media or on television, it feels like all day, every day, we're being bombarded with campaign ads for mayoral candidates. I want to ask all of you, Myra first, as we look at who could potentially be New York's next mayor, if that next mayor wants to create a more equitable New York, specifically for women, what should a top priority be? Myra?
Sure, thank you. Well, one full disclosure, I'm in Washington, D.C. 0 to 3 is housed down here, so I'm not a New Yorker. But I will speak about this, what we want to see across the country. We want to make sure that women have jobs that are meaningful jobs and that are family sustaining wages. We want to make sure that all families have access to paid family and medical leave. That they can use in the event of an adoption or the birth of a child, that they can use in the unfortunate event of illness of a loved one, themselves or their children. We also want to make sure, obviously, as I spoke about earlier, that we have high quality early learning experiences. We need to have a birth to 5 early learning system, and not childcare here and pre-K here. It needs to be fully integrated. So that needs to be part of it. And then we also need to make sure that we think about care at the other end of the spectrum, that we have care that is supported for parents, people who are caring for aging parents or people who are disabled, that we have home and community-based services that are fully funded to make sure that care is high quality and that it is responsive to the needs of families. I do want to say a few things about what LaRay said. She said so many great gems I just want to underscore. One, the first, there's a lot of evidence to support what you're experiencing or what you said your parents and family, maybe Healthy Steps and Healthy Families talked about, which is that parents have actually shown that throughout the pandemic, the one thing that gives them joy is their children, even in the midst of so much challenge. So we need to be thinking about that. How do we make sure that that is protected and that is sustained without all of this strife? The other thing I really want to underscore is mental health. We know so many babies right now and parents are exhibiting signs of stress. The Rapid EC project that's out of the University of Oregon, I'm happy to partner with them. We at 0 to 3 partner with them on so much. There's been this really interesting study that shows when parents who experience financial hardship, material hardship, which is disproportionately borne on Black and Brown families despite socioeconomic levels, even higher income Black and Brown families experience material hardship because of that lack of wealth. They then in turn show or experience mental health. They talk about being stressed. What's really interesting and something we cannot lose is it has this cascading effect on young children, that when parents report having exhibiting stress, they then see it in their children, in regression, sleep regression, irritability. So we really have to think about what's happening right now is affecting adults, but it's really having impact on children, and we have to make sure mayor, governor, whatever, everybody's thinking about the social, emotional well-being of children. The last thing I'll say is next week, we have families from all 50 states and the district coming, well, it'll be virtual this year, but talking to their members of Congress through our annual event called Strolling Thunder, where parents will be talking directly with their members to talk about the need for infant and early childhood mental health, for paid leave, and for childcare. So people can sign up and look into that, because there is a movement of parents who are advocating for themselves and their communities.
Myra, do we need to broaden or lengthen the scope when we talk about childcare in this country, right? We talk about paid parental leave, we talk about newborn care, but for every parent on this call, we got those kids living with us until they're 18. And we look at childcare as something really for infants, for young children, but one of the things holding women and men from going back to work is school-age children, right? If school is virtual or school is hybrid, there are very few jobs out there that start at 9:30 and end at 2:40 and have 2 months off in the summer. Do we need to reimagine and broaden out the scope of how we define childcare in the US?
I think we need to make sure that it is affordable. We have a system that has a subsidy for children 0 to age 13 for after school care. That needs to be fully invested. You're right. After school care is an afterthought. It's often forgotten about, at least by policymakers. Now, parents think about it all the time. So we need to make sure that we have a fully comprehensive care system. And again, I'm going to say that care needs to be there for those people who are aging and people who are disabled, that we have a full care infrastructure, care economy that we are all thinking about as we think about building back better in this country right now.
Bertina, I turn the mayor question to you. What does the next mayor of New York City need to focus on if the goal, and they certainly all say that, is to make this city more equitable?
I would certainly amplify Myra's great point about investment in childcare, as well as elder care, and this theme around supports for mental health. That certainly is something that shows up in our program with the young adults who go through NPower. But I would also say, in addition to that, of course, investment in alternative pathway programs for workforce development, digital literacy.
One more time.
Investment for alternative workforce programs like NPower that directly connect young adults to jobs. I would also say digital literacy for high school students, something that is sorely underfunded. And another piece that we haven't really talked about on this call, but as we think about the digital divide here in New York City, one opportunity I think we think about the digital divide around devices and access to broadband, but it's also access to basic support and digital skills. So an investment in an idea like a community help desk that allows for local community residents, individuals in aging centers, public school children to be able to access a 24/7 help desk support center. Particularly as more and more of our daily life is dependent on access to online tools, is something that also should be considered.
What about this type of training and support, not just for high schoolers or young adults, for seniors, right? We talk about, ageism in the workforce. So many seniors have aged out of certain jobs, or they don't feel safe post-COVID going back, and they're not digitally literate. We saw that in terms of we saw that when we were discussing access to the vaccine. If your only option was to go online and you didn't know how to do that, you couldn't get the vaccine. Isn't digital literacy a priority for all ages in this city?
It absolutely should be. And while our program is focused on young adults for workforce development leading to jobs, digital literacy should be something broadly available. Interestingly, we've got a pilot in Baltimore for a community help desk, and one of the greatest demands and biggest sources of calls is coming from aging centers. And it's older residents of Baltimore who want to know how to download Zoom, who need to be able to access their telehealth appointments. And so I do believe that that is going to be a growing need that our next mayor has got to pay attention to.
LaRay, I see you nodding. I'm guessing, lack of digital literacy is a big problem for seniors, and you saw it during the vaccine rollout.
Well, I would just echo what Bertina just said, because during the and really during the initial stages of the pandemic and even now, a lot of us as healthcare providers, particularly outpatient healthcare providers, we pivoted to telemedicine. However, as was just said, if in fact you don't have adequate broadband, and forget the devices, and you're not literate in terms of using digital devices, then we've created another barrier to healthcare, particularly for seniors, and many of whom have chronic medical conditions that could be very appropriately addressed using a telemedicine approach. We also are creating lack of access to behavioral health or mental health, because we have a paucity of mental health and mental health professionals. If there was greater digital literacy, we could provide mental health services through a telehealth modality. So I just echo how incredibly important that new mayor, that on this issue, that new mayor should be focusing on. But I would also say, and I'm not going to talk about healthcare as my top list as to what a new mayor should be focused on, because I would say safe, affordable housing, because without housing, you can't have health. And particularly in areas like Brooklyn, where there's just a huge amount of gentrification and displacement of lower income folks, and or people who are doubling and tripling up in households. Then we saw how that was exacerbated during COVID. But not having safe and affordable housing really impacts in an extremely detrimental way the health outcomes of women, the health and well-being of children, and the economic stability of families. And then next, I've already talked about mental health, but I'd also say investments in education and through early pre-K or three-year-old education up through post-high school, and recognizing that folks need accessibility to post-high school education, whether it's college or not, whether it's the certification programs, but making sure that people have that opportunity. And we can't require folks to take out loans that put them behind the eighth ball when they're finished with whatever the education or certification is.
Myra, in the last year, we saw some of the biggest companies, the biggest employers across the country, across the world, make billions and billions of dollars for themselves, for their shareholders, besides what they can do philanthropically, because philanthropically is a kiss. What could they do to change the way they operate in terms of offering childcare and other services to their workers and their employees that wouldn't just better the lives of their employees, it would broaden out who they hire and be better for the companies? What could they do?
Yes, thank you for that. Thank you for that question. And I want to make sure, I want to amplify something, or maybe expand what LaRay said. I really want to make sure that we understand that learning happens at birth. And so we want to make sure that, early education doesn't just start with 3-year-olds, but it actually starts with infant and toddler care. So I have to put that piece in there, and I see you nodding, so I know you agree. So there are so many things that companies can do. One is paid family medical leave. We are pushing for a national comprehensive solution, and we are hopeful that will come to fruition in the coming months. But that is something that corporations should be supporting, and we see a lot of corporations and small businesses embrace that. We know that paid family medical leave is good for retaining workers. It's good clearly in terms of from a public health standpoint in the midst of a pandemic, but it's also really good for children's attachment. So that is key. In terms of on-site childcare, we saw that in the American Jobs Plan, that there is funding for that. I think that is great. We certainly want to see everybody, think about ways that they can expand access to childcare. But what I want corporations to think about is not just thinking about, building these beautiful childcare sites at their headquarters, where predominantly, high wage earners, people with advanced degrees, predominantly white male workforces, that is there. I want to see the same beautiful, high quality, well compensated staff working in childcare settings that are on site for factory workers, your distribution center. If you really want to make an impact in your communities and you are thinking about how you can do better with all those billions of dollars, $70 billion for, one person just made this year in the midst of the pandemic, let's think about what that could look like. If you could really invest your dollars in supporting your low wage workforce. And then of course you should be raising those wages to make sure that they are able to show up for you and do the work that they're doing for you without sacrificing the way that we know so many families are sacrificing.
Bertina, do you see this moment as an opportunity? People talk about this, the recovery, let's get back to normal. Getting back to normal wouldn't serve our most vulnerable, certainly wouldn't serve our most vulnerable women. Do you see this moment as an opportunity?
Oh, by all means. And it is one that we cannot afford to waste. And you're absolutely right. We can't just get back to normal. We have to do better. And one thing I want to talk about for a moment is the power of mothers. And I mention that because from time to time, we hear companies think about hiring young moms as a risk, but in truth, we know, and I think the moms on this phone call know, that young women are some of the best hires a company can make. There is nobody who can juggle, multitask, schedule, get it done like the mother of a young child. And if you're a single mom, just multiply that by 10. So I just think it's important to establish that focus on the strengths and the power of the assets that young mothers bring to any job. I think that increasingly companies in this moment in time, first, we've got to eliminate the wage gap that has grown during the pandemic. It's always existed. It's worsened now. It's especially worsened for women of color. So let's address that, number one. Number two, let's invest more in skills training for incumbent employees. We know that there might be a young woman who graduated from NPower who's making $50,000 a year at a good help desk job, but could be making $80,000 a year with just 1 or 2 additional certifications that a company could pay for. That is an investment not only in the long-term earnings potential for that woman, but it's a great investment in human capital for the company and for the benefit of even the cybersecurity operations potentially of that company. Investing in mentoring and sponsorship, 2 key actions we know work at retaining and developing women of color. But finally, I would also lastly add, how many times do I hear, oh, I just cannot find a person of color who's a cloud technologist. That has got to end. Great companies hire great people with good entry-level skills and invest in their training and development as technology leaders and technology practitioners and technology leaders. So that is, I think, a big step that can go well beyond the well-written words on a nicely crafted press release.
Those companies don't have to search for those technologists. They have the power to create them.
Every day.
LaRay, everyone listening to this call tonight, I'm going to speak for everyone, is grateful for the work that you do, is honored, is inspired. What can we do? People who are listening right now, when they hang up, when they sit down with their family and talk about this call, or they call someone, what can they do? What can we do?
Well, I would say that that everyone has a responsibility to ensure that there is a strong healthcare infrastructure in their community. And so when people are voting for their elected officials at all levels, nationally in state houses as well as locally, they should ask the question, what are you going to do to make sure that we have a strong healthcare infrastructure? If we've learned nothing over the last year with the pandemic, what we've learned is that no matter what community COVID struck, and COVID really shone a bright light on where there were gaps in healthcare. So that would be the first thing that I would say, that everyone listening. I'd also say that everyone listening should get vaccinated. Take that vaccine. Take that vaccine, because notwithstanding our need not to get back to the normal, we do need to get back to life. And we do need to be able to use the only thing that we know that will help us do that, and that is being vaccinated. And of course, using and adhering to the other public health practices that your mother taught you. Your mother taught you to wash your hands. Your mother taught you to, when you sneeze, to cover your mouth. Your mother taught you all these good rules that are basic common sense and that have been known to work from a public health perspective. Getting that vaccine. And I would also say that everyone listening here should appreciate that no matter where one lives, the universe gets smaller and smaller and smaller. So if you're wealthy and you're in the suburbs versus if you're in a rural community or if you're in a large urban center, any virus can affect all of us. So we are all responsible for one another and making sure that everyone has access to safe and excellent and accessible healthcare.
Amen to all of that. Myra, what gives you hope right now, and what could we do?
The families that we talk to on a daily basis are Strolling Thunder family advocates, parent advocates who are gearing up to tell very personal stories about what they have experienced in the pandemic and how they show up every day for their families and their children and their communities. It gives me incredible hope. And I know there are, for every 50 of the 51 Strolling Thunder families we have, I know there are countless more who are doing the same in their communities. And I will say what's happening right now, the conversations we're having. Someone told me last summer that childcare there was a 900% increase in childcare coverage in the media last summer. I don't even know what it is now, but people are talking about these issues and really, rethinking so many things that we advocates like myself and all of us on the call have been talking about for a long time, and the visibility for these very important issues and getting their long overdue attention. So that does give me hope.
Bertina, last point to you, what gives you hope?
What gives me hope is that, echoing what Myra said, I am seeing that all the right conversations now are beginning to happen. I'm even seeing some baby steps and some giant strides towards real action. But look, I would say, turning the mirror on myself, white women and white men need to be absolutely relentless and persistent in advocating for change and being accountable. And that is something that we have to live with urgency, and it's beginning to happen. We have a ways to go, but we have to be relentless.
Wow, thank you. I am grateful for this evening, getting to spend this time with the three of you. I'm grateful to be part of Robin Hood. All of you give me a tremendous amount of hope, as does the work of Robin Hood and Robin Hood's relentless commitment to helping women, specifically mothers, not just get back on their feet, but taking steps forward to live better, stronger, smarter lives. I want to thank everyone just for participating tonight. I know how busy everyone's lives are, for caring to learn about this, for caring to invest and be partners. Thank you all so much. And Robin Hood, I am forever grateful for everything that you do and inspired by every project that you lead. Thank you all for participating tonight.
Thank you.
Thank you.